Finally, recheck for feeling, warmth, and color. Soft splints can also be used on other parts of the body. This towel is immobilizing an injured forearm.
To review, sling and binders, anatomic splints, and soft splints are all effective ways to immobilize an injury to a muscle, bone, or joint. Follow these steps to care for an injury to a muscle, bone, or joint. Support the injured area above and below the site of the injury. Check for feeling, warmth, and color below the injured area. Immobilize and secure the injured area. Recheck for feeling, warmth, and color below the injured area. Injuries to the head, neck, and back are extremely serious and can lead to disability or death. They must be handled with great care using specialized rescue skills.
Fortunately, head, neck, and back injuries are rare, but they can happen anywhere in your facility, and you need to be prepared. These injuries can occur from falls, collisions, and head-first entries into shallow water. You should always suspect a possible head, neck, or back injury in the following situations. Any injury caused by entry into shallow water. Injury as a result of a fall greater than standing height. Injury involving a diving board, water slide, or a person entering water from a height, such as an embankment, cliff, or tower. A person holding his or her neck or head and complaining of pain. A person complaining of neck or back pain, tingling in the extremities, or weakness. Someone who appears to be frail or over 65 years of age. A person who is not fully alert. Someone who appears to be intoxicated. Or injury from a force which impacts the head.
You should also look for signs and symptoms that could indicate a possible head, neck, or back injury. These include changes in level of consciousness, severe pain or pressure in the head, neck, or back, loss of balance, partial or complete loss of movement of any body area, tingling or loss of sensation in the hands, fingers, feet, or toes, persistent headache, unusual bumps, bruises, or depressions on the head, neck, or back, seizures, blood or other fluids in the ears or nose, heavy external bleeding of the head, neck, or back, impaired breathing or vision as a result of injury, nausea or vomiting, or bruising of the head, especially around the eyes and behind the ears.
If you suspect that someone has had a head, neck, or back injury on land, act immediately and carefully. Activate the facility's EAP and follow the general procedures for injury or sudden illness on land. Size up the scene. Perform an initial assessment. Summon EMS personnel. Perform a secondary assessment. Use appropriate personal protective equipment such as disposable gloves and breathing barriers.
If you suspect that a patron has a head, neck, or back injury, you must use rescue skills developed for these types of injuries. They're designed to minimize movement of the victim.
Minimizing movement is very important because even a little movement could cause further injury. So if you suspect a head, neck, or back injury, tell the victim not to shake or nod the head and simply answer yes or no to your questions.
Let's start by watching how to stabilize a head, neck, or back injury if the victim is on land and lying down. Kneel behind the victim's head and place one hand on each side of the head to minimize movement. Stay in this position and watch and listen for changes in consciousness or breathing until EMS personnel arrive and take over.
If the victim is in a sitting position, face the victim and place one hand on each side of her head to minimize movement. Stay in this position and watch and listen for changes in consciousness or breathing until EMS personnel arrive and take over.
If the victim is standing, place one hand on each side of his head to provide inline stabilization. Do not have the victim sit or lie down. If he becomes unstable, complains of dizziness, has a potential life-threatening condition, or begins to lose consciousness, slowly lower him to the ground with the assistance of other lifeguards. Try to maintain inline stabilization while the victim is being lowered.
If the victim's condition is stable and your facility requires the victim to be secured to a backboard, get help from 2 other lifeguards and follow these steps. Lifeguard 1 approaches the victim from the front and provides inline stabilization by placing one hand on each side of the head. Lifeguards 2 and 3 position the backboard against the victim's back so that it is centered behind the victim. They must be careful not to cause any movement to the inline stabilization. While Lifeguard 3 holds the backboard, Lifeguard 2 secures the victim's body to the board by placing and securing straps across the chest and under the armpits and over the hips and thighs. This helps prevent the victim from sliding on the backboard when it is lowered. Lifeguard 2 rechecks the straps to be sure that they are secure. Lifeguard 2 then secures the victim's head to the backboard using a head immobilizer and strap across the victim's forehead. Lifeguards 2 and 3 place their inside hands underneath the victim's armpits and grasp the backboard through the handholds that are at the victim's armpit level or higher. When the victim is secured to the board, Lifeguard 1 moves to the back and grasps the top of the backboard. Lifeguard 1 tells the victim that they are going to lower him to the ground. Lifeguard 1 then gives a signal and all 3 lifeguards slowly and gently lower the victim. Lifeguards 2 and 3 should walk forward and bend at the knees to avoid injuring their own backs. Head, neck, and back injuries are serious enough when they happen on land, but when they occur in the water, you've got to respond right away. If the victim isn't able to move and is face down in the water, there's no way to breathe. You have to get there fast.
If you suspect a head, neck, or back injury, follow these general rescue procedures. Activate the emergency action plan, assess the victim's condition, enter the water safely, and perform an appropriate rescue. If possible, move the victim to shallow water. Check for consciousness and for signs of life. Remove the victim from the water and give emergency care as needed.
There are 2 different techniques we use to stabilize a victim's head and neck in the water: the head splint technique and the head and chin support. We'll start with the head splint technique for a victim who is face up in shallow water.
To perform the head splint technique for a face-up victim in shallow water, stand behind the victim's head and submerge so the water level is at your neck. Grasp his arms midway between the shoulder and elbow. Gently place the victim's arms alongside his head and squeeze them together. This helps keep the head in line with the rest of the body. Reposition yourself to the victim's side as you secure the head with his arms. Position his head close to the crook of your arm, making sure that the head remains in line with the rest of his body. Maintain the victim in this position until help arrives. Check for consciousness and signs of life.
If a victim is face down in shallow water, you can also use the head splint technique to turn her face up. Approach the victim from the side. Grasp the victim's arms midway between the shoulder and elbow. Place the victim's arms alongside the head and squeeze them together to keep the head in line with the rest of the body. Glide the victim slowly forward. As you move, rotate the victim toward you until her face is out of the water. Position the victim's head close to the crook of your arm, making sure that the head remains in line with the rest of her body. Maintain this position in the water until help arrives. Check for consciousness and signs of life.
The other technique used to stabilize an injury to the head, neck, or back is called the head and chin support. If the victim is face up, approach from the side. Lower your body to about shoulder depth in the water. Place one of your forearms along the length of the victim's breastbone and grasp the lower jaw. At the same time, place your other forearm along his spine and grasp the back of his head. Squeeze the forearms together, clamping the victim's chest and back. Hold the victim face up in the water until help arrives. Check for consciousness and signs of life.
If the victim is face down in shallow water, you can use the head and chin support to turn him face up. Lower your body to about shoulder depth in the water. Place one of your forearms along the length of his breastbone and grasp the lower jaw. At the same time, place your other forearm along his spine and grasp the back of his head. Squeeze the forearms together, clamping the victim's chest and back. Move forward and rotate the victim toward you as you submerge. Maintain inline stabilization as you roll slowly under the victim. Surface on the other side, bringing his face out of the water. Keep him stabilized in this position until help arrives. Check for consciousness and signs of life.
If the victim is in extreme shallow water, such as in a zero-depth pool, modify the head splint technique like this. Approach from the side. Grasp the victim's right arm with your right hand and his left arm with your left hand, and move the arm slowly and carefully into position until the head is secure between the victim's arms. Roll the victim toward you as you step from his side toward his head. Lower the arm closest to you so the victim's arms go over the top of your arm as you move toward the head. Maintain pressure against the victim's head during this maneuver to minimize movement of the head and neck.
The head-chin support and head splint techniques can also be used to stabilize the victim in deep water. The only significant difference is that in deep water, you'll use your rescue tube for support. To perform the head splint on a victim who is face up in deep water, approach from behind the victim's head. Use your rescue tube for support. Grasp the victim's arms midway between the shoulder and elbow. Gently place the victim's arms alongside the head and squeeze them together to help keep the head in line with the rest of the body. Reposition yourself to the victim's side as you secure the head with the arms. Position the victim's head close to the crook of your arm, making sure that the head remains in line with the rest of her body. Maintain the victim in this position and gently move her to shallow water if possible.
Using the head splint technique to turn a face-down victim over in deep water is the same as in shallow water, but you'll use your rescue tube for support as you position the victim and turn him over. Maintain stabilization and move the victim to shallow water if possible.
You can use the head and chin support for a face-up victim in deep water. Again, use your rescue tube for support. Maintain stabilization and move the victim to shallow water if possible. The head and chin support